All right, good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. I'm Paul Thomas, and Mr. Bill Kearney is in the studio once again from Northlake Medical Pharmacy. Bill, it's been a long night, I hear.
Yeah, I had a little call from the alarm company last night that said there's some activity at your store, and I said, well, I think everybody's out of there, and they called back and said, no, there's been some glass breakage, and so I was settled in for a nice watch NCIS or something like that. Decided that maybe I better come in, and of course there had been a break-in, and one of our felons had decided that he was a little unhappy with the way things were in the shopping center, so he took a big rock out of the parking lot, 3 of them, matter of fact,
Wow.
and threw one through the window next to our durable medical equipment, and glass shattered all over everything, and then one next to the door, the slider door, and then one on the far side, and glass all over. And of course, you couldn't leave that unattended, so the landlord came down, Mr. Bernetti, and his partner, Mr. Duker, and I chatted with the police, and he had thrown a rock through 2 or 3 of the other businesses there also and shattered their windows. And but the law requires the pharmacy to be secure, so we had to get a hold of ProServe or ServPro and come out and got the windows all secured with plywood, and then I had a conference call at 4 o'clock this morning, so I got home about 11:30 and decided I wasn't going to be able to sleep. So I had my conference call, and then I came in at 7 to start the cleanup, and then the guys met me there at 8 o'clock, and we're open for business again, and it's just a mess. But
Wow. So were they targeting your store or just...
the guy had they arrested the guy, and he admitted that he had done it, and he was on parole, I guess. He'd just gotten out of prison or jail, and and I don't know what his reason was. Never heard why he did it, but it was definitely to create vandalism, and
Yeah.
never.
And nothing was taken?
Nothing was taken.
Wow.
I mean, he would have had to been wearing heavy boots with all the glass that was inside the door, and he didn't take anything. Of course, the others weren't retail establishments except the carpet place, and but we managed to get it all cleaned up, and we're operating as usual. But if I kind of doze off in the middle of the show, it'll be that's kind of why. So
Wow, man, that is just it's unbelievable. I mean, really.
And we were so glad that it wasn't raining so much at that point. So we were able to get all the things up and secure, and then the ServPro people were here this morning early, and with all kinds of vacuums and people to help secure the place. And glass was all over the shelves and all over, these things. These glass just breaks into minute pieces, and we had racks of wind chimes, expensive wind chimes, $200 or $300. That was knocked over. I had a walker and a wheelchair that was shattered, and right next to my office door. And when I went in with the police, they said, there's got to be a rock around here. We found this huge rock, probably 3 times the size of my fist, and then we found 2 more where he'd thrown them through. And the police were very thorough. They took pictures, and I'm sure added a little excitement to the evening. And but we're secure now. And
Wow, that's just...
this has been my insurance agent came out also, Tom Lincoln, and for the shopping center, and so we had quite a group of people there. helping us secure the place so nobody could to get in. It was kind of ironic that somebody would throw a rock through a pharmacy window and not go in and try to steal the drugs, but we were pretty fortunate. So we're here, and we're going to be talking about your health.
Wow.
And one of the things we're going to be talking about is a seminar that I went to last Friday with physicians and pharmacists and nurse practitioners on the opiate abuse in Lake County, and that's hydrocodone, oxycodone, MS-Contin, OxyContin, all of the kinds of drugs that there's a big epidemic going on all over the United States. One thing we learned, unfortunately, that Lake County was the worst county in the state of California for the most opiates prescribed, and was the #1 county for the most opiate deaths. We have been going on a program since November of 2015 to reduce the amount of opiate prescribing we've had. And there was just I think it was on 60 Minutes. It was on, maybe it was on just the CBS News the other day about Cleveland, Ohio, and they have one death in the ER every day from opiate overuse. And where we used to think it was strictly oxycodone and Vicodin and Norco, hydrocodone, it is major switch to fentanyl. Fentanyl is a drug that's normally brand name called Norgesic. It usually comes in a patch, and it lasts for 72 hours. Now they're making it more potent. It's 100 times more potent than morphine. And the new drug, which is a derivative of fentanyl, is 100 times more potent than the regular fentanyl. So we have these people who are just desperate to get high, and they take it and they die. And they don't know what they're taking. They think many times they're taking oxycodone or hydrocodone, and they're actually taking fentanyl that's labeled that way. And this is not in a patch form. It's in a tablet form or a capsule form. And they're taking it orally, or they're shooting up heroin, because heroin is so much cheaper now. So what we learned is most of the addiction for opiates are white people. By and large, we were kind of wondering why we prescribe narcotics to so many people. And the big influence in narcotic addiction and narcotic prescribing, I think, was in 1996 when a company called Purdue Frederick came out with a drug called OxyContin. Now, OxyContin is a drug that's an opiate for people, that was designed for people in chronic pain, but it was marketed as a drug that will not get you high, will maintain a pain threshold above that level of pain, so you're not constantly going into those peaks and valleys of this is good for every 4 to 6 hours, and so at the end of 6 hours you're way below that pain threshold, and you need to get more of a drug up to get above that pain threshold. And so this was going to keep an equal amount of blood level of the opiate, so there weren't those peaks and valleys. And the selling point was you could still work, you could still enjoy your family, you wouldn't get high from it, it would just subdue your pain. So everybody went on this new drug. It was relatively expensive at the time, but nothing like it is today. It's like $1,200 or $1,300 now for a OxyContin long release medication of oxycodone, and we were giving it to everybody, and now we're trying to get everybody off of it because it's no longer effective after about 3 to 6 weeks. And I know that's hard for people who are taking oxycodone or morphine or any of those kind of drugs. But eventually what you're treating is the side effects of kind of withdrawing, because you need to up the dose because you reach a plateau level. So the beginning in 1996 with the prescribing of this just continued, and then they used it as a fifth vital sign. So in hospitals, when you saw this shiny face, this smiling face, and you were going to tell how much pain you'd been in, if it was a frowny face and you wanted more oxycodone, that's what you marked, regardless of how you were doing. So there was no evidence at the time of long-term therapy, and risks of long-term therapy being effective for chronic pain. So now we find out it was a huge risk, and there are tons of people that are addicted, and not necessarily because you wanted to be addicted, because whenever you had a procedure done, the doctor would prescribe oxycodone or hydrocodone. So it was either Norco, Vicodin, or OxyContin. And eventually, when that prescription ran out and we told the physician we were still in pain, they wrote you another prescription for it. We even went so far to schedule it as a Schedule II drug that needed to have a diagnosis on it that would allow you to have the prescription but not ever allowed it to be refilled. You would have to see the doctor every time you got the prescription. And we taught people how to tolerate this, and we've convinced the physicians, or the physicians convinced us of when the patient needed that. And so we had several physicians talking to us at Marymount on Friday, and they were talking about when they changed people that were now into tapering people off opiates, is when they discover it's what the drug is doing to the patient is more than what the drug is doing to the patient is more predominant than what the drug is doing for the patient. So when the side effects, as we've talked about many times, the risk becomes greater than the benefit, it's time to take people off that medication. So they start tapering people slowly, and that's the program for people on opiates, is to taper slowly so the patient still feels good, and they need to buy into the fact that we're making them better by taking them off the drug. 5% of the daily dose is what they normally start to taper people off, and it's very important. Some people take as long as 2 years to get off of these drugs. Unfortunately, along with the opiates, the pain medication, many people are on muscle relaxants, and many people are on benzodiazepines. And so whether you realize it or not, if you're a patient for chronic pain, it is much more difficult to withdraw you off of the Xanax or the Ativan or the Valium than it is off the narcotic. And some of the physicians say it takes up to 3 years for them to get a patient off of the benzodiazepines. Now, we have a program that we've talked about before for the elderly, and it's called the Beers Criteria, where if it becomes too much of a problem, what we call an anticholinergic drug that dries you up, that makes your eyes dry, that makes your saliva disappear, then we need to do something to alleviate those side effects. So we start treating people for withdrawal, and we put them, part of the seminar on Friday was about dispensing Narcan, naloxone, for people who have a tendency to overdose. And one thing we've talked about on this radio program before is what a difference the environment is now on somebody doing opiates than it was back in the 60s when people were doing heroin and they're doing heroin again and marijuana. They had a tendency in the 60s to be in a group environment and kind of similar to what the protest was at Cal Berkeley last week, which was an amazing mess and a disgrace to the American public, and a disgrace of what the students were doing in Berkeley to destroy the university, to harm people. And it happened to be all about a speaker that was a conservative speaker that the Young Republicans had decided to give freedom of speech, just like the people that are the Hillary supporters wanted to have freedom of speech because they were unhappy with the new president. Well, freedom of speech was fine for those people, but it wasn't fine for a conservative individual who wanted to give some credence and some kind of validity to the other side. So when we're talking about people that were starting to taper off medications, we talk about the Narcan, which is what they call an opiate antagonist, and a person can still be taking the morphine or the oxycodone, and they can be in a coma, and you give them an injection of Narcan, you can save their life. And now pharmacists are able to prescribe that to an opiate addict that may be in danger of killing themselves to give in case they overdose. And what's happening in many cases is a person who had been through rehab, got straight, didn't have a problem anymore, and he or she decided at some point to fall off the wagon, and so they took the same dose of the pain medication that they took before they went to rehab. Now their body isn't used to this drug anymore. The tolerance they build up for years and years is gone. They take the same dose now and they die. And as much as we think this isn't affecting our society, believe me, this was a group from Lake County that was that has the status of more people per capita getting opiates than any other county in the state of California, and more deaths per opiate prescription than any other county in the state of California. So we have a job to do. Both the pharmacists, the physicians, the nurse practitioners, the mid-levels have to be alert about treating these people. One of the other drugs that we use is buprenorphine, which is Subutex, and we keep people on this to bring them down from the opiates. Many times their buprenorphine clinics, one of the pharmacists was from Grass Valley or Placerville, someplace like that, and he had a buprenorphine clinic, and he would be giving people buprenorphine, and they would still be on their opiate. Then they would slowly withdraw them from their opiate, because buprenorphine allows you to take both of those drugs, but you don't get high from the opiate anymore. So it's pretty safe to give the drug that satisfies that craving, and you can easily take them off the opiate addiction. Then they do the same thing and try to get them off the benzodiazepines, because many people with chronic back pain say they need a muscle relaxant at the same time. Well, guess what? Those muscle relaxants are benzodiazepines many times, and Flexeril or cyclobenzaprine is probably the best choice, but there's a tremendous amount of people addicted to Soma, crisaprotol, and I can tell a Soma addict by just them talking. It turns into a drug that's similar that we used years and years ago for a tranquilizer drug called meprobamate. And people have a way of, when they're addicted to that drug, of showing it through their speech. So it becomes a lot more recognizable, and the DEA is on a mission to get rid of any protocol that clinics or physicians have to give benzodiazepines along with their opiate, and many times they will give them a muscle relaxant, and they will give them an opiate, and then they will give them anxiety medications. All three of those medications add up to a lethal dose if you haven't had it before. And it's called a cocktail for narcotics. And the DEA, the Drug Enforcement Agency, is looking at going through that process, excuse me, of identifying those prescriptions where that cocktail is being prescribed, and either finding the pharmacy for not running them through the Cures, the Department of Justice website that tells you if they're getting it anyplace else, or they will contact the physician. The Drug Enforcement Agency is really reluctant to penalize the physician, and their group of physicians that belong to the American Medical Association or a physicians organization are reluctant to turn in another physician that may be doing this. It's not your local physician that you would normally think of that's doing it, and it not necessarily would be your pain physician, but several people that are engaged in it are actually feel like they're benefiting the patient by keeping them addicted. Now, there is a law in California that allows you to prescribe opiate medication and recognize that you have made them an addict. Very few physicians want to fill that form out, so we just do it kind of under the radar. So opiate addiction is a huge thing internationally, nationally, locally, state-wise, every place you look. Hydrocodone, oxycodone were the top drugs prescribed in the United States for several years, starting in 1996. We are trying to reverse that trend, and not that we want to keep you out of pain, and not that we want to keep you in pain. We want to keep you out of pain. So we need to find a combination of medications that allow you to do exactly what we said the drug would do in the beginning. And I questioned a physician at the seminar because he says, what we want to do is convince the patient that they can have a normal life, they can enjoy their family, they can continue their job, they can lead a productive life from now on. And I said to the physician, do you realize that's the exact marketing tool that Purdue Frederick, the manufacturer of OxyContin, told physicians and patients about in the beginning? This is what you can take to make sure you retain your job, you have a quality of life, you celebrate holidays with your family, you can go on cruises, vacations, and all that, and still be on this medication. And now we're telling them they can have a drug-free life and be able to do that and have some sort of a relief of pain. Not that you're never going to be out of pain, and not that these patients are out of pain, even taking that medication. It gets to the point where you still hurt all the time. It may be not that high degree pain that you had, but you still have pain. And this drug isn't doing you any good. You may be taking it just at bedtime now, and that's what you need for you to get some sleep. And then you have to go through some guidelines on sleep apnea and how to progress beyond that. So a big epidemic, a big thing to pay a lot of attention to. We're going to take a break, and when we come back, we're going to talk about some memory supplements that aren't as good as what they advertise, and some new vaccine guidelines for the flu. Hey, all you weekend jocks, listen up. As we get into winter, workout plans change. Instead of playing softball and soccer, we're working out in the gym, playing basketball, or running on the treadmill. Use the RICE method to treat an injury right away, so on Monday when you go back to work, no one ever knows you aren't the macho guy you want everybody to think you are. The RICE method is rest, ice, compression, and elevation. Rest. For most injuries, rest the area until the pain decreases. Ice. Ice is the most effective treatment for reducing inflammation, pain, and swelling of injured muscles. Apply ice as soon as possible after an injury, even if you're going straight to the doctor. Compress. Between icings, wrap the injured area with an elastic bandage to help control swelling and provide support. Elevate. Raising the injured area above your heart to help reduce swelling by draining excess fluid. And at night, place a pillow under the area to support and raise it. Northlake Medical Pharmacy, with 2 locations to serve you. Hill Road next to Sutter Lakeside Hospital and outside the Bruno Shops.
Captain Eric Lawrence was training Afghan soldiers when his truck was hit by an IED.
I was on the way from Kandahar to Kalat, hit an IED that just took the truck and threw it up in the air and slammed it on the ground. I knew at first that I got hurt pretty bad because I couldn't move my legs. I sat home alone for months. I didn't want that anymore. I wanted to go back to work. I was hesitant at first, because I didn't work for a good year. I want to be a productive person. I don't want to be a drain on society. I want to be a positive thing in society. PVA helped me write my resume, got me a job interview. I got the job.
Helping veterans like Eric is what we've done for over 65 years. Paralyzed Veterans of America, paving access for veterans' employment through Operation PAVE. For more information, visit pva.org. A public service message from Paralyzed Veterans of America.
Want to know what I like best about high school sports? I love watching my son run on the field. I love the fact that since he's been playing high school sports, he's making better decisions. And I love knowing that with the proper equipment, education, conditioning, and coaching, high school sports here in California are safer than ever before. And that's something I really love.
This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
In the past, when a musician or band recorded a song that was worth owning, people would buy it. And that inspired artists to create more music. It was a rewarding time for both artist and listener. Today, many music lovers refuse to pay anything to own a new song. Why pay for music when it can be downloaded illegally for free? When you download music illegally, you're stealing, and it's not a victimless crime. You're denying payment for work that rightfully belongs to the artist. So please, don't download music, movies, or software illegally. Do what's right. Pay for them. Get them legally and support aspiring artists who are busy creating your next favorite song.
Illegal downloads hurt, but you have the power to stop them. To learn more, go to www.ncpc.org/getreal. That's ncpc.org/getreal. Brought to you by the National Crime Prevention Council and the Bureau of Justice Assistance, U.S. Department of Justice.
All right, we're back.
Well, Paul, I know you try to be as sharp as you can, and I don't know if you take any health drugs to make your mental acuity better.
No, but I should.
Well, don't take Prevagen. Have you heard of Prevagen?
I have not. I really have not heard of any of those.
Well, Prevagen is a product that's falsely advertised as a memory booster, and they claim the product can get into the human brain that charges the brain, but they pushed back on insisting its product is safe and calling the FTC a lame duck federal agency, which people are about to be replaced by the administration of President Trump. So in the latest battle on an ongoing war between the federal government and Quincy Bioscience, who are the manufacturers, the Food and Drug Administration filed a warning letter saying it was making medical claims for a product that had not gone through the formal drug approval process. Now, this drug, we can't even get it in our pharmacy. You see it advertised at CVS and Walgreens and Walmart, and I'm not sure why it's not available to us. Extensive advertising campaign, including TV spots on national broadcasts and cable networks such as CNN, Fox News, and NBC, featured charts depicting the rapid and dramatic improvement in the memory for users of the product. Pricey, sells for anywhere between $40 and $90 for a bottle, for a bottle, and it's has a protein in it which is made by some jellyfish. And I can remember a year or so ago when this first came out, and people talked about, even in the pharmacist's letter, about the validity of this drug and how smart people were going to be. But you know how I'm very strict about studies that are done, and they need to be big studies. This study only involved 218 people taking 10 milligrams of the Prevagen or a placebo, and that failed to show a statistical significant improvement in the treatment group over the placebo group. Placebo, for those of you who don't know, is a medication that looks exactly like the other medication. The person that's in the study has no idea if they're taking the real product or the placebo. And it didn't, there was not improvements in the treatment group over the placebo group on any of the 9 computerized cognitive tests. The Alzheimer's Association didn't want to weigh in on it in particular, but their science officer, Maria Carrillo, noted there was no product out there that has been proven to help memory. That's not what they're claiming when they're marketing this drug. The Alzheimer's Association has serious concerns about people using dietary supplements excuse me, as an alternative or in addition to FDA-approved therapies in an attempt to treat or prevent Alzheimer's disease. First and foremost, the effectiveness and safety are unknown. In addition to the purity of the product is unknown. Now, it sounds like we're singling this drug out, but I want you to understand that the Food and Drug Administration, they can challenge what you're marketing it for, but the purity isn't involved in any over-the-counter product. The Food and Drug Administration does not request that any over-the-counter product has to prove its purity. And you've heard me talk about in 1994 where the Dietary Substance Act came into being. That's when everybody started marketing these medications for different things that were herbals, that were not proprietary medications. Nonetheless, the company said the study did not show that the product works. The defendants, however, don't have studies showing that orally administered Prevagen can cross the human blood-brain barrier and therefore do not have evidence that it enters the human brain. I can tell you right now, if this drug was effective, as they say it is, we would all be taking this medication, especially after you turn about 50 and you look across the table at the guy in the studio whose name is Paul and you call him John, and you realize that maybe you should have been taking Prevagen. And so it doesn't work that way. If it did, like I say, we'd all be taking it. So there's no reason for lame duck studies, no reason for the Food and Drug Administration or the Federal Trade Commission to rush this complaint through, because it actually doesn't matter, because it's marketed as a supplement. The Dietary Supplement Health and Education Act that we just talked about specifically exempts vitamins and supplements from FDA's pre-marketing scrutiny, although the agency can warn against the products found to be dangerous. And the Federal Trade Commission, as well as the Justice Department and state officials, can act against misleading marketing practices, and that's really where all this is coming from. So the marketers, people that actually market Prevagen, preyed on the fears of older consumers experiencing age-related memory loss. But one critical thing these marketers forgot is that their claims need to be backed up by real scientific evidence. Why is it so hard to get scientific evidence on an over-the-counter product? Well, the reason is it's a natural substance, and anybody can do those studies, but no drug manufacturer is going to put themselves out on the limb and pay for all this marketing, a huge marketing, to prove that it's effective, because when you come out with a marketing and it proves it's effective, anybody can buy it. So, and anybody can manufacture it or put it into a bottle. First and foremost, the effectiveness and safety are unknown. In addition, the purity is unknown. The company said it will fight the charges. They purposely disagree with the allegations made by 2 federal trade commissioners. It's another example of government overreach and regulation. Members of Congress often defend these companies. The FDA has frequently complained that the drug companies allow supplement makers to sell useless and often harmful products to trusting consumers. I just watched a thing on television yesterday, and it was during either the San Francisco news or the national news, and it was about this ointment or cream that this gal who was advertising it put on her father's eyes to get rid of the bags underneath the eyes. And they showed it actually working within 30 seconds or something, and the bags disappeared. Now, I don't know as soon as the camera went off if the bags reappeared, but if there was something that really did that, and you don't know how many people would have during primetime television, even one time, would have bought that product because it looked like it was a miracle. You don't know what was time-lapse photography. You don't know if it ever really happened. You can, with computer programs, you can cause these things to happen and never know if it's really the truth or not. So again, it was an over-the-counter product. It was a natural product, and they don't have to prove that. So we mentioned at the break time that we were going to be talking about some new guidance on seasonal flu shots. We found out last year that we have eliminated nasal flu vaccines and modifying the flu shot advice for public with the people with egg allergies. It also tweaks the recommendations for vaccines against HPV, hepatitis B. All adults, even kids, need immunizations to help them from prevent and getting and spreading disease that could result in poor health and missed work and medical bills and not being able to care for the family. The CDC, the Center for Disease Control, sets the adult immunization schedule based on recommendations from the advisory committee. And there's major changes coming up that even though we're mostly through the flu season this year, for next year, remember, there's not going to be any more nasal flu vaccine. Unlike traditional flu shots made from the dead virus, the nasal flu vaccine was marketed as FluMist, was from a weakened form of live virus, and found it largely ineffective. It's not used a ton in adult medicine, and flu vaccines for people with egg allergies, there's a major change. We used to always ask on the questionnaire, are you allergic to eggs? Because the vaccine was made out of egg protein. The major change is that egg allergic people, whether they have mild or more serious allergies, can receive any age-appropriate flu vaccine. And last year, people with more serious egg allergies were advised to stick with an egg-free flu vaccine. The new guidance states that even people who developed symptoms like swelling or lightheadedness or breathing difficulties can get either type of the flu shot. So we're going to talk about this again as the flu season approaches, but they should get one shot under supervision of a healthcare provider who's able to recognize and manage the severe allergic reactions. We actually have an EpiPen with 2 doses in it. That's right in my office, which is the office that we do immunizations in. So we have the ability to monitor you and make sure there isn't anything drastic going on. New advice for people who are HIV positive. Adults with HIV should receive 2 doses of a meningococcal vaccine that protects against the deadly bacterial infection of the brain and spinal cord. And this is a new one that I'd never heard until today. and that was hepatitis B for adults with chronic liver disease. The new vaccine adds people infected with hepatitis C to the list of those with chronic liver disease who could benefit from a Hep B virus series. So others who should receive those shots are people with cirrhosis, fatty liver disease, alcoholic liver disease, autoimmune hepatitis, and people with elevated levels of certain liver enzymes. There's a lot of people that fatty liver disease is the most common liver disorder in Western industrialized countries. So here, all of a sudden, we're seeing, instead of spending $84,000 for a hepatitis C vaccine, you can take a hepatitis B vaccine that's much less expensive, and it's not maybe going to cure hepatitis C, but it's going to improve your chances greatly. So if you're obese, you're more likely to have fat in your liver, which means that you would be on the list to get a hepatitis B vaccination. U.S. adult immunization rates fall short of the recommended levels. Flu vaccines are really tough sell because it requires annual vaccination, and noting that flu vaccine is safe and can prevent death and complications from severe virus, it's really alarming how many people do not get it. Also of concern, only 20% of the adults 19 and older have had a Tdap vaccine. Now, you probably wonder what Tdap is, and it is a combination for tetanus, for diphtheria, and for whooping cough. So tetanus, diphtheria, and pertussis are the three diseases, and pertussis is whooping cough. That is very effective, and every time a patient that is pregnant, a person becomes pregnant, they need to get another Tdap shot. Even though you're getting a tetanus and diphtheria at the same time, it's perfectly safe to get the whooping cough or the pertussis at the same time, because every year that you are pregnant, the vaccine needs to be put into your system. So people have insurance have 2 to 5 times more likely to be vaccinated because the cost issue is a big barrier. We have so many people out there that should get Zostavax vaccine. That's for shingles. About one of the questions that I was asked the other day, if I've had shingles before, do I need to get a Zostavax vaccine? And it's a low amount. It's about 7% of the people that have been immunized for shingles and have gotten them that can get it again. We're trying to get Zostavax approved by Medicare D because everybody in the Medicare D category is going to be more likely to be at risk for shingles. And if you don't know what shingles is and you haven't seen it before, it's advertised tremendously on television, and it shows this person with rashes look like big boils all over their back and their front, and that's shingles. And it's a form of herpes, and it is very, very painful. The nerve endings from the cells go to the surface of your skin. And it's like a million root canals, because that's exactly what happened with the root canal. You take the cap off, and there is a root exposed. And so they deaden that nerve and fill that up. That same thing happens in shingles, only it could be a shirt touching your back. It could be air. It could be almost anything to put you in orbit because of the drastic pain. So we would like to see more and more people get the shingles vaccine. It costs around $220 or $30 to get the shot unless your Medicare D pays for it. And many times it does. And even if it doesn't pay for all of it, it may pay for half of it, which is certainly worth not getting the shingles vaccine. So we're going to be catching you up all through the year about new challenges in immunizations and new things that you probably need to get. One of those is pneumonia. If you're past 65 and you haven't had either pneumonia shot, you need to get the Prevnar first, which is the 13, and then a year later get the 23. So a little bit risky that you haven't got them yet if you're that age, but it's very wise to do so. I saw this article yesterday in the few minutes we have left, and it kind of shocked me. And the name of the article was "This So-Called Natural Cure Can Cause Heart Attacks and Strokes." And it was about drinking hydrogen peroxide. Hydrogen peroxide is this inexpensive bottle that you can get that is oxygenated water. And you use it because it bubbles when you put it on an injury, and many times bubbles out the bacteria that's in that injury. But drinking hydrogen peroxide poisoned nearly 300 people and killed at least 5 over a 10-year period. And what they're doing is drinking high concentration hydrogen peroxide because it's promoted in a lot of alternative medicine circles as a so-called natural cure. But as we say, nearly 300 people have been poisoned and 5 have died. An assistant professor of emergency medicine at the University of Colorado had data from 2001 and 2011 and looked specifically for poisonings from hydrogen peroxide solutions of 10% or more. Most of those cases were 30 to 40%. Then those high formulas aren't normally sold in drugstores. They're generally marketed for industrial or commercial use. But in a scary twist, they're also sold by some alternative medicine retailers and promoted as an active ingredient in what is sometimes referred to as superwater. And this is like in a health food store or alternative medication store. For people who follow those regimens, they involve placing a dropper full of high concentration peroxide into a large quantity of water or another liquid, so it's fairly diluted. And they feel like it's hyperoxygenating or putting an extra oxygen into your beverage that somehow improves your health. There isn't any scientific benefit. Though it's properly diluted, it's probably harmless, but it doesn't have any proven benefit. So if you accidentally take too much, it could have a serious consequence. And so we go back to the old thing, if a little bit works, then a lot works better. That's not the case in hydrogen peroxide. There would be serious consequences if someone else in the household accidentally drinks non-diluted peroxide, not realizing the danger. So there was people who took it, a mouthful of peroxide, who had severe chemical burns in their throat and their stomach. Most cases of severe injury or death were due to a heart attack or stroke. And in that case, what happens is the oxygen bubbles from the peroxide, and it can enter the bloodstream and block off blood flow to the brain or the heart. And it shows that our focus as healthcare providers, at least initially, should be evaluating and treating these possible embolisms. And an embolism is when a blood vessel spikes from inflammation and goes to the top of the blood vessel. So you look in the blood vessel and you think everything is fine, but on top of that blood vessel is a balloon. And when that balloon breaks, it's instant death. So some of these patients improved after they received hyperbaric oxygen therapy. That's what we use for scuba divers who return to the surface too quickly and get the bends. But that didn't work for everybody, so especially people who weren't treated right away. So the hydrogen peroxide most people have in their medicine cabinets that comes in a brown bottle is usually only 3 to 5%, not nearly as dangerous. If you take a swallow, it might burn a little bit, but it's probably not going to cause any health problems. So that goes for swallowing a little bit of toothpaste also. So here we are with something that we keep on the shelf every day. We think it's harmless. We feel like it's harmless. We haven't heard of any problems. And I'm not bad-mouthing alternative medicine websites or alternative medicine stores, but many times those aren't naturopaths that are selling the medication. They're retailers who are trying to make a buck, and I have nothing against that. But when you get something as dangerous as hydrogen peroxide, 30 or 40%, and you really don't know anything about it, you need to call your pharmacist or your physician and ask them if you feel like it's something that you should continue to be taking and if it's dangerous to your health. But you need to make that phone call before you start that, not afterward. So we have a couple minutes left, and we are right in the middle of another storm that's consuming and putting a lot of liquid energy into our lake, and people are probably going to be underwater by the end of this evening. And we need to be aware that to drive with caution. If you see a flooded sign out there, don't take it that path. If you need your prescription delivered and you're not our customer, have that prescription transferred over to our pharmacy. We'll deliver it the next day. And if we can get through the road also, and just be aware that it's a different venue out there than we've had for several years, and we need to make sure we protect ourselves and our bodies, and we don't let ourselves miss an opportunity to pick up our medication when we need it. So we're going to be getting into some other things next week as far as your health goes, and we're trying to keep everything as current as we can so you understand that some of the risks that we take with these things are important, and some of the things may not seem, for example, the Prevagen. We found out Paul doesn't take anything to get smart because he's already smart.
Sure.
And we found out that that if you did take some of these medications, they may not be appropriate for you anyway, and you may be wasting your money. And especially if you're one of those patients who is trying to save money to get the prescriptions that have been prescribed for you, and you don't have enough money to do that, this is the time to get yourself on the program and take care of yourself appropriately. We'd like to remind you we're Northlake Medical Pharmacies with 2 locations for you. At 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart at 347 Lakeport Boulevard. Come in through the boarded up windows and call us at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk on AM 1270 and 96.5 FM KXBX Lakeport.